Welcome to Spirituality. Spirituality is anything that pertains to the personal relationship with a non-material life force or higher power. It's not defined as a specific religion or an organized system of beliefs. It can be different for every person you ask. It's very specific for each individual person. Spirituality to many people is an incredibly important part of their health and wellness, and it's also an integral part of holistic care we provide as nurses. Spirituality affects people's and values and beliefs about health and wellness and illness, life, and even death. A big part of spirituality is having faith in something for which there is no proof or evidence. They don't need proof that something exists, they just know it does. Another aspect of spirituality is hope. Hope is what gives people a positive outlook on whatever life situation they are in. Hope is what keeps people going. Nurses touch all aspects of spirituality and hope, and we need to be very mindful of people's spirituality when we take care of our patients. For some, spirituality gives their life meaning and a purpose, and they may need their spirituality for love and belonging and feeling like they're part of a community. Spirituality can have a religious context, but it doesn't have to. It can also be cultural, but again, it doesn't have to be. Spirituality can also affect how people suffer, which is a state of distress that occurs when a person's integrity is threatened, either physically or mentally. Spirituality can also change during the life changes, so we often refer to spirituality as a journey because it can change so much during a lifetime. Even though spirituality is a very important part of people's health, it's a very neglected part of nursing care. There are many reasons for this, and the biggest is our lack of understanding of our own spirituality. Many people are not comfortable with their own beliefs, so they just don't discuss them at all. Another big reason is the lack of time in healthcare. Nurses don't have the time to sit with their patients and discuss deep topics like spirituality. I mentioned that spirituality and spiritual care is often overlooked by nurses, and sometimes our lack of assessment can be detrimental to our patients. Many times we see our patients as anxious or irritated or angry, when really they're struggling spiritually and they're in spiritual distress. If we do a quick assessment, we may be able to help these patients with a need we didn't even know they had. To assess for spiritual needs, we should be asking what their beliefs and practices are. We should ask them how their spirituality affects their everyday life and how it gives them meaning and purpose to their life. We should also assess if they have anyone they need forgiveness from or anyone they need to offer forgiveness to. Forgiveness is something that plays a huge role in death and dying, and many people who are dying are in spiritual distress because of forgiveness they need for themselves, or they have someone they need to forgive before they die. We also want to assess if they have any spiritual food needs, any spiritual considerations related to pain or illness or even death. We need to ask them if there are any certain times a day they need quiet or alone time to practice their spirituality as much as we can offer it. We should ask if there are any days coming up that have significant meaning that we should be mindful of. But the biggest thing we need to do is to not push our own beliefs on the person. When we implement spiritual care, we need to make sure we stay within our ethical and professional boundaries. We do not push our beliefs on our patients, and we don't treat our patients disrespectfully if they don't believe the same thing we do. As nurses, we need to offer to be a supportive and healing presence in their care, which means to not judge. That does not mean we have to believe the same things they do. It just means we'll support them with what they need. That may mean we need to call their church and have someone come visit them, or have the hospital chaplain come visit, or maybe we give them a few minutes of quiet time to pray or meditate. We may need to make sure they have any spiritual objects nearby, like any jewelry, rosaries, or religious text. If you feel like doing so, you may pray with your patient or offer to pray for them, but this is not required. We only do what we are comfortable with. One thing that we do get involved with are the conflicts that may arise from spiritual beliefs and medical treatments. Think back to the beginning of Block 1 when we discussed ethical dilemmas. Spirituality and medical treatments can often cause spiritual distress in our patients. Vaccinations, end-of-life decisions, specifically withdrawing care, abortions, sterilization procedures, cancer treatments, organ donation, and blood products are all major decisions in healthcare that can cause ethical dilemmas related to spirituality in our patients. If our patients are dealing with a serious illness or potential death, we may need to help them find meaning in their life and find meaning in their death. We may need to help them find the purpose of their life and help them accept that what stage of life is coming up next with the serious illness or death. The last concept I want to discuss related to spirituality is hope. Hope is not always related to spirituality, but it's definitely something that helps provide comfort when a patient is dealing with an illness, potentially death, or other serious life events. Hope is not giving up, not letting go, or not accepting that the next stage is not a bad stage, it's just the next one. Hope is something that gets talked about a lot with cancer patients and in the ICU. We have hope that the treatments will work, hope that the body will heal, hope that the illness will go away. We also have hope that the pain will lessen or that death comes quickly. Hope is something that we can offer, and it's something we can take away quickly. When we offer hope, we're encouraging relationships with healthcare workers and patients and their families by listening, by answering questions honestly and in ways that they can understand. We build trust. We support their decisions and their autonomy. We also offer hope when we set aside our own assumptions and our own attitudes towards the choices the patients are making in regards to their care, especially around death and dying. We can hinder hope by isolating our patients and not listening to them or making them feel shameful for the choices regarding their own care. If we don't treat their pain or symptoms effectively, we're taking away their hope for feeling better. If we leave our patients alone and not offer the support and guidance, we hinder hope. And once hope is lost, it's very hard to get back. I've witnessed many patients give up hope and quickly die because they felt they had nothing left to live for, even if they didn't have a terminal diagnosis. I've also seen people who should have died walk out of the hospital because their hope was so strong it would not allow them to give up, and they never gave up. Hope is a very powerful mindset that as nurses we affect every day, positively and negatively. And this is the end of spirituality.